We have some excellent speakers with us this evening, so I will be keeping these opening remarks very brief. Our theme for this meeting is COVID-19 has not gone away, only the restrictions on it have. Just today, it was reported that there were 314 new deaths. There were over 1,800 deaths in the last 7 days, and we seem to be around this level for a very long time. The Health Secretary himself said today that the peak pressures on the NHS are likely to be ahead of us, and we know that key functions of the NHS, such as cancer treatments, are not functioning. On top of all of this, there are now 1.3 million people suffering from long COVID, and employers report it as one of the key reasons for staff sickness. None of that sounds like it's over. Our speakers this evening will examine these issues and many more. And our very first speaker is Richard van Abendorf, who is a Labour Party activist. If we are going to launch a successful pushback against current policy, we will need to do that at every level of society and take every possible avenue towards a more logical policy of suppressing the virus. Richard has done brilliant work in getting his local Labour Party to adopt a policy for virus suppression. So we're really pleased to have him share his experience in achieving that. Welcome, Richard.
Thank you very much, and thanks for inviting me to this excellent campaign. It's been so good to have the Zero COVID campaign here, and along with people like Indy Sage, Deepti Gurdasani, some of the few people talking the truth and countering the misinformation and propaganda we get inundated by so many. Because people, as you say, are being harmed, and we have to do everything we can, I believe, articulating the arguments, getting the facts out, mobilizing people, putting pressure, and we locally have been trying to work out how to do this optimally. I'm a local Labour Party member, and we managed to get a motion through after a lot of work over the last few months, which hopefully someone can attach in the chat function there. But I'm not going to talk to the details of the motion, because these motions, obviously, you have to update them, and I was going to give a bit of background to it. Because I think it's so important. I mean, we tried a year ago and we lost narrowly. I mean, Lewisham Deptford is an excellent constituency. I'm a delegate to it, and it's the left have the dominant vote, but it's quite tight. So and this thing was hard work, and so it's not saying it's easy, but I think if we can do all we can, and even if you'd lost the vote, it's still important to do that. I mean, the background to it all was, there's been a WhatsApp group of people who are interested in this topic, which has kind of grown steadily across the left in the constituency and wider. When I was redrafting a motion, and I got help here, I have to say, from Labour. There's a Labour members Zero COVID WhatsApp group, which was very useful. And I'm sure there are lots of other groups like this in other forums and community groups. When I got a draft there, I kind of reworked that to try and make it appropriate. We decided it would need to be an emergency motion in this case, because it was in January this year. And obviously, statistical barriers were being smashed. They were moving to reopening. And the Labour Party leadership at that point, as it still is, was just supporting, sadly, the government and saying, yes, we've got to have to move to reopening, and wasn't standing up nearly enough. So we put this motion together, and I made sure, learning from previous times, to involve as much as possible, whilst keeping it kind of fairly tight, other local campaigns. So I happen to be part of the local TUC and also a hospital campaign. So I circulated a draft of the motion, and they came up with interesting and useful amendments, sometimes typos, sometimes, nuances which are important to have there, and to make sure everyone feels that they are part of that. That was also useful around local left WhatsApp groups, to show them it was worth definitely attending this meeting. We have a delegates in our constituency, a delegates meeting, and it was important to show the debate about this important issue. And then also, over this time, I've been kind of sharing the excellent work done by Zero COVID Coalition and tweets, etc. So people well updated and knew my position. But it's not just that, it's a fight, and every organization will have its rules, and it's good to know the rules, and because there was a mobilization of people loyal to the MP, who is loyal to the Labour leadership, and they clearly worked hard to get their numbers out. So every vote counts. So I make sure understood the rules and the wording of the motion, and clarified confusions, and there were still some typos in the final motion, but we managed to get it through by a solid majority. Even the presentation, I'd worked hard. I think it's all about the detail when you've got a fight here, and I made sure it was a balance. The motion says a lot, but I made sure in my introduction, it was a difficult meeting. There wasn't much time, but I put a personal account. I have a neighbour who's suffered a lot, essentially because of the health service under such pressure and no visits allowed, and no one was allowed to see him when he was very ill, a consequence of COVID. So I was giving that personal touch. And then I make sure I had a very good seconder for the motion, because there were some questions thrown out on the exact statistics. And this person, who I'd built up a great relationship over a long time, was able to give a very good account, and all you need to do is go to global statistics. You can, and compare Britain with countries like China, obviously, New Zealand, and just put everything in context to show things can be different and things have to be different. So, the motion got through, and I think it's important because it can be used for propaganda and build alliances, and it's got me here, essentially. I hope a lot of people here, whether they're in the Labour Party or in the Green Party or in a local community group or trade union branch, should be thinking about what they can do to get the message out. Because even if you don't win, over time you can. And I think we need to get the truth out, because this is a massive campaign. It's not going to go away. We need to suppress the virus. We need to have and link up with all the other campaigns that are obviously opposing the consequences of it. So not everyone may support zero COVID, but they'll support safer schools. And obviously it's horrific, the hospitalisations and the long COVID in children going on and expanding today. It affect workers who are forced into unfair environments. And obviously the hospital campaign in Lewisham, we're blessed with the excellent Save Lewisham Hospital campaign. They had thoughts on it, and concerns, because it's really ravaging health staff. So I'd urge other people to do it, and follow the Twitter feed of Lewisham, the Zero COVID campaign, and I'd like to thank. I was involved. I got support from the local, from the National Labour Members Zero COVID group, who helped draft the motion, and they've asked me to raise the fact there are other campaigns going on, other issues. For example, MPs are being called to support the COVID legalisation. And the renewal of that legal bill going through. So there are other campaigns we can all join up with. And I think we need this network. We need to grow it. We need to get the information out. And thank you for all your good work. And it's great to hear Belle's going to be on here, and people like Richard Horton and all the other wonderful speakers. So carry on the good work. We can all play our little role, even in little old Lewisham Deptford. Thank you very much.
Thank you so much, Richard, and thank you for the work that you're doing in your local CRP and the model that, that can be followed. Just to reiterate, the motion is actually in the chat function if anybody wants to check that out. Our next speaker will be Belle Ribeiro Addy MP. Belle will speak to us about the current global situation and the lessons we can learn from other countries, both positive and negative. Welcome, Belle.
Thank you very much, Nemo, and thank you all for inviting me to speak. I'm really pleased to be following Richard. And what I want to talk about is the overall situation internationally and how we in this country will fit into that. And it will confirm the idea that the pandemic is very far from being over, despite what people want us to believe. Now, we are part of the world, and we have one of its more reckless governments, as I'm sure you all know, and we can't be immune from what is happening everywhere else. There are now 10,000 deaths a day globally, compared to the all-time high of 14,000 this time last year, and they're still rising. There are about 2.8 million new cases per day, and this is 3 times more than the peak in the second wave in April last year. Regionally, most of the deaths are concentrated in the richest countries, and the official data suggests that there's been about 5.75 million deaths cumulatively. Other estimates, such as The Economist, put it far higher. But throughout the entire pandemic, it's the richest countries that have been the worst. Europe and North America account for more than half of the total global, 3 million in all. And this is despite being the richest country and having better healthcare in general, and of course, having access to vaccines. Combined, they account for little more than 1 in 7 of the world's population, but more than half of the official death toll. Something has clearly gone terribly wrong. How is this possible? The richest countries who have the vaccines with the worst death tolls, but the answer lies right there in policy. At the other end of the spectrum is the African continent, which has almost no vaccine, much lower level of public health provision, and is comprised of much poorer countries. In per capita terms, the death rates in North America and Europe are both 12 times what they are in Africa. Now, my family is from Ghana, and I was back there at Christmas, and Ghana has only the average vaccination rate for Africa as a whole, about 10%. But what it does have is social solidarity. African countries generally have a priority of public health. Now, I'm not claiming that everything is perfect there, far from it, but they do have face masks, and almost everybody wears them. They have sanitizers, they use ventilation, they meet outdoors at every opportunity. They do proper testing, they do social distancing. Lockdown was heavy-handed and difficult because of the size of the informal sectors of the economy, but it was short-lived and effective. They also think the policy here is unbelievably bad. A few of my relatives that have visited were shocked at the height of the pandemic to get on public transport and to go into shops and see people not complying with what was then the rules. But one of the strangest things about the policy of this and other Western governments is not only have they created huge death tolls in their own countries, but they seem to want the same for others. So there's been a huge pressure on countries pursuing anything like a zero COVID policy to abandon it. And this has been concentrated against countries mainly in Asia because they're the most committed to the policy, countries such as Australia, China, Japan, New Zealand, Thailand, and Vietnam. Now, these countries don't have much in common economically or politically, but they all did go through the regional trauma of SARS-2 and have learned valuable lessons about virus suppression. But in addition to the terrible policy on vaccine access, Western governments have disgracefully put enormous pressure on these countries to abandon their zero COVID policies and to abandon their populations in the way that the US, Britain, and most other EU countries have. A recent Telegraph piece was titled, St. Jacinda has made controlling COVID a myopic moral crusade. There was another piece by foreign journalists in Beijing for the Olympics complaining that the barman and the woman at the chocolate fountain in her hotel both wear masks. And the campaigns also have a blatant side, mobilizing the far right in violent demonstrations against restrictions. I'm sorry to say that the pressure has yielded some results, and the Australian authorities have definitely given ground. And the outcome is clear to see. Over almost 2 years of the pandemic, Australia had roughly just 2,200 COVID deaths. From Christmas Day till now, it has risen to 4,200 deaths. That's what following Western policies in the pandemic does. That's what abandoning a zero COVID policy does. Opening up and freedom is freedom for the virus, and it's deadly to the population. Now, this is the terrain that the US, British, French, and other governments have chosen to fight on. And this freedom is ultimately going to end in sickness and death. The end of the pandemic means the end of pretending to care about it. Protecting the economy means protecting, for them, big pharma, fake PPE companies, and Tory donors. It's a complete bonanza. And we've often heard how countries with terrible outcomes like Sweden should be the model. The approach there seems to be a non-aggression pact with the virus, but the virus took no notice and it carried on anyway. Or another model, at least based on some science, has been Israel. The idea that you can simply jab your way out of the crisis. Israel is one of the most highly vaccinated countries in the world, and it's now onto its 4th booster jabs, but cases and deaths in Israel are soaring. And I'm a strong advocate of vaccination. I'm fully jabbed. That's triple jabs for now, and urge others to get jabbed if they're not. I also think it's a complete scandal that most countries in the global south have access to almost no vaccines. This is because of rich countries hoarding and the refusal to waive the vaccine patents to protect the profits of big pharma. But I think the experience of a country like Israel that has high vaccination levels is a serious warning to us all, especially in those countries which are now relying solely on vaccines to see us through. Britain is one such country, and we should never be alarmist about the experience that a vaccine-only policy runs out of road. Israel now has its highest ever death toll and its bigger ever wave of cases, despite being very highly vaccinated. And to show how bad this is, it's about the same deaths per day now per capita as the US does, about 8 per million. Now, there is a combination of factors, including gaps in take-up, others who cannot be jabbed, the waning effectiveness of vaccines, and over time, and the evolution of new strains of the virus. But whatever the specific combination of factors in any country, any point in time, there's clearly an endpoint, at least for now, where vaccines cannot prevent the virus spreading like wildfire. In this country, we are now highly vaccinated, which is great, but the government has freed the virus, and we have been stuck at over 200 deaths a day for over a month now. Letting the virus circulate freely and only having jabs as our defense is not working. And that's what our government and governments all across Europe and North America are doing. We still need a suppression strategy. We still need zero COVID. Now, this really is my overall message. At the outset of the pandemic, one of the representatives of the WHO was asked what countries should do, prioritize masks or vaccines or social distancing. And the answer was clear: do it all and do it now. And that is still the answer. Zero COVID is still very much the answer. Thank you.
Thank you so much, Val. Thank you. I'm delighted now to welcome back Richard Horton, who, among many other accomplishments, is editor-in-chief of The Lancet. It's been some time since he's been able to join us, so it's a great pleasure to have him with us once again. Richard will be able to give us an overview of the current situation in this country, both in terms of understanding the current severity of the pandemic, as well as future prospects based on current government policy settings. Welcome, Richard Horton.
Thanks so much. It's lovely to be back with you, and thanks very much to Belle, actually, for setting the stage so brilliantly a moment ago. And some of the things I say, I think, might resonate with what she's had to say. You may have heard recently that the regional director for the World Health Organization covering Europe gave a very optimistic picture of where we are currently. Sorry for the sirens in the background. An optimistic picture recently of where we stand with the pandemic. He spoke about a long period of tranquility that faces Europe. He talked about a plausible end game to the pandemic and an enduring peace. Now, I understand that it's his job to be encouraging and to be as optimistic as possible. But I think that that approach, which is also one that we're seeing our current government following, is far too narrow a geographical perspective. It ignores the fact that we're still facing a global pandemic, and it is conveying a false reassurance that will definitely and indeed is breeding complacency. So let's just look at some facts. Although we are past the peak of Omicron at the moment, we still have in the United Kingdom intensely high levels of transmission of the virus, particularly in Northern Ireland and in England, but also very high levels in Scotland and Wales as well. It is certainly true that hospitalisations are down about 9% week on week at the moment. Deaths within 28 days of a positive test are down 7% week on week, but the numbers are still high. Over 11,000 hospitalizations in 1 week, 1,700 deaths in 1 week. These numbers are not small. This is not a period of tranquility. This is not an end game. We're still in the midst of this pandemic. And I would also urge caution about talking up the vaccination program. We have had a successful program, but there are huge gaps. There are 5 million people in the United Kingdom who have not had 1 dose even of the vaccine. That's a substantial number of susceptible people living side by side with us. They are at risk of contracting infection and with all the sequelae that come with infection. We talk about the booster campaign, and yes, we've done very well in many ways with the booster campaign, but there are 20 million people across the country who have not had a booster dose of the vaccine. So if we recognize that we still have a very vulnerable population, that Omicron may be milder than Delta, but it is most definitely not a mild virus, that we're in a highly dynamic situation. I don't want to get into the complexities of the virus, but there is a second variant of Omicron called BA2, which is prolonging the effect of the current surge. So we're not in a static phase of the pandemic, it is moving as we speak. When we recognize that the United Kingdom is one of the worst performing countries in the world, with over 175,000 deaths, according to the ONS, that we remain one of the top 10 countries for cases and for deaths. And if we also recognize that it's predicted from January the 31st to June the 1st, over those months, end of January to beginning of June, there will be a further 4,000 deaths in the United Kingdom, then you can see that we are still in the teeth of a public health crisis. COVID-19 remains the second commonest cause of death in our country after ischemic heart disease. You wouldn't believe that, would you, if you listened to politicians talk about COVID-19 today? You just wouldn't think that it's the second commonest cause of death in our country. You'd think as if this was all past, this was all history, and we all go back to normal. No, no, no. We're right in the middle still, I'm afraid. Now, if we look ahead to where we're going, assuming, and this is a massive assumption, assuming there will be no new variant, we can project ahead and think that as we come through spring and summer, that we might get to a position of an endemic virus in our society. But there's a massive misconception here about the meaning of the word endemic. Endemic does not mean harmless. Endemic means, or can mean, that something is widespread and deadly. Malaria is endemic, and it kills hundreds of millions of people every year. So just getting to a place where a virus is endemic is not good. That is not a good place for us to aim for. That should not be the goal. So we have to be, or we should be, intensely vigilant about what we're doing, protecting the vulnerable, protecting the NHS and essential services, doing everything we can to keep our schools open, but continuing to vaccinate and address vaccine hesitancy. Mask wearing is absolutely essential to continue mask wearing. I said to you a moment ago that it's projected that there will be 4,000 deaths through February, March, April, May, and June. If we had 80% mask wearing in our population during those months, we could save 1,000 lives. So mask wearing has a massive impact on averting death. And we need to keep testing new variants. So that's the situation in the United Kingdom. But the United Kingdom, we may think we're an island, but we're not an island. We're connected to the rest of the world. And I just want to say a word or two, if I can, about the rest of Europe, because Europe is not in a good place. Continental Europe's not in a good place either, especially if you look at the eastern reaches of the continent, which are also experiencing increased levels of transmission. In continental Europe today, there are 10 million cases per day of coronavirus infection. 24 countries across the European continent have the famous R value greater than 1, indicating that transmission is progressing exponentially. Hospitalisations and deaths are still increasing in many countries in Europe. 5,000 deaths a day, per day in Europe. Again, just as in the United Kingdom, COVID-19 is the second biggest killer after heart disease amongst our neighbours in Europe. Countries are experiencing stress on their intensive care facilities. I mentioned the 4,000 figure for projected deaths in the UK up to June. Guess what it is in Europe? The projected number of deaths in Europe up to the 1st of June is 174,000. So again, tranquil, an end game, enduring peace? Come on, no way, absolutely no way. We are being sold a lie by even the World Health Organization. I'm sad to say, because I'm a big supporter of WHO in many ways, but they got it wrong in this particular case. And COVID will return. It will come back at the end of this year. Why? Because there'll be waning immunity from natural infection and the vaccines, and we'll be going into winter. It's a seasonal virus. So going into the winter of 2022, it will come back again, sure as anything. So we need to be thinking about how we mitigate, how we prevent that surge from taking place in all the ways that I've been describing to you. Now, Belle has given you a very good summary of where we are globally, and I'm not going to repeat that, but I do just want to say a word about, again, vaccination, because this should drive us crazy, absolutely crazy. 10 million doses of the vaccine have been given worldwide to almost 5 billion people. That's 63% of the world population. It sounds great, but if you look at who's been vaccinated with 2 doses of the vaccine, the picture isn't so great at all. There are 28 countries in the world, most of them in sub-Saharan Africa, where less than 10% of the population have been vaccinated. Nigeria, the biggest, most populous country in Africa, only 2.5% of the population have been vaccinated. How can we be happy with that as a global community? Ethiopia, 1.4%. Afghanistan, where we escaped so atrociously last summer, 10% of the population vaccinated. So this issue of vaccine inequity, which we don't seem to be talking about anymore, is absolutely central for protecting ourselves as we look to the rest of 2022. One last point, and then I will stop, because we are learning lessons about how to handle this pandemic almost week by week, and we are not learning these lessons in any way, shape, or form. The most striking lesson that we learned just a week ago, based on research by a group called the Covid-19 National Preparedness Collaborators, is that the measures of pandemic preparedness that we have relied on for years, measuring public health capacities, hospital capacities, numbers of health workers, and so on, they are useless at predicting whether you can be prepared or not for a pandemic. What matters? What really, really, really matters? The answer is trust. Trust in government. Because if people don't trust their government, they're not going to pay attention to the public health messages. If we don't trust each other, because our society is fractured, because it's corrupt, because we've got a breakdown in the way we communicate with one another, then we don't look after one another. And what have we seen? This is where this situation we're in with the pandemic connects with what we're seeing with the government today, right now in Downing Street. What we have seen with this government in recent months is whatever trust they may have had, it is completely collapsed. Any trust in government has been erased, which puts us right now, given the picture that I've described for the UK, for Europe, and what Belle described for the rest of the world, puts us in the worst possible position for protecting our public as we go through 2022. Getting rid of this government and getting a government in place that we can trust is the most important public health maneuver that we can implement to defeat this pandemic in the UK. And with that, I will stop. Thank you.
Thank you very, very much, Richard. Thank you for that. We are also really pleased to welcome back Vicky van der Togt, who has spoken at our meetings previously. Vicky is a long COVID researcher and co-founder of Pandemic Aid Networks, a network of groups from around the world that work together in the fight against COVID-19. She will be able to update us on the current situation in Europe, the spread of the virus, and the response of various governments. Welcome back, Vicky.
Thank you, and thank you so much for inviting me here. I will speak a little bit about the situation in Europe, but I'd like to start off with a little bit of an update based on my own situation, because we've been hearing a lot about how Omicron is mild, and I have some firsthand experience. So I got reinfected at the end of last year, and I can say for sure that Omicron is not mild, and it for sure is not for a long COVID patient. So upon reinfection, at day 2, I struggled with what felt like a minor heart attack. And that was basically the first symptom that I had. And it only got worse from there. I've been really out of it, haven't been able to work for a couple of weeks afterwards, and am slowly getting back to working again. And that was an infection for me after being infected and having had 2 shots. So you can see that, even within the current narrative, right, that an infection provides some type of immunity, getting the vaccine provides some sense of immunity. It didn't protect me against getting really ill again, and it didn't protect me from getting worse and my long COVID symptoms getting worse again. That was just for me as a long COVID patient, but at the same time, my partner also got infected, and for him, it was the first time he got infected. This was after 3 vaccines. And I'm sad to say that even though this infection is now 5 weeks ago, he hasn't been able to work since. So even though we don't have the data on long COVID or the prevalence of long COVID with Omicron, I know firsthand that long COVID is still occurring, also with Omicron. And also I can just say, and I've said this beforehand, that even though we don't have the data yet, we currently have no reason to assume that long COVID will not occur with the Omicron variant as it has with previous variants. If anything, we see that the vaccine efficacy against Omicron disease is slightly less than it was for Delta. And so I think we can also draw some conclusions on that for the prevalence of long COVID. Although I am for sure not willing to give any conclusive comments on that. But it is for sure something that we should be aware of. And we also see the effects of this happening in the long COVID support groups. So I am part of the long COVID Netherlands support group, as well as that I support multiple long COVID groups from around the world. And we've all seen a gigantic rise in new members that are applying for the groups, people that weren't even aware of long COVID, or even people who had previous infections, recovered fully, but developed long COVID at a second infection. So this is also something that we as long COVID advocates and leaders of support groups are really worried about. Up until now, there's been this narrative that, you can recover from COVID, you can get reinfected, and it provides some sort of immunity. But what those effects of those reinfections actually are, we have very little data on that. And I'm sad to say that also a part of this data is being actively suppressed in multiple countries, including the Netherlands. And so there's really a need for this data to be shared, for transparency around this data, because it is of the utmost importance that we get a good idea of what these reinfections are actually causing in terms of disease burden. So I wanted to start with that because I think it's important thing to mention. Reinfections, we know that they are occurring. We know that a large part of the infections currently are actually reinfections. And so they should be seen as such. And we should also draw some conclusions of the effects of reinfection versus the effects of an unvaccinated person getting infected, the effects of a vaccinated person getting infected. I'd also like to touch on simply the effects of reinfection for me. Like I said, I've gone have gotten worse. My cognitive symptoms have gotten way worse. Basically, every single long COVID symptom has gotten worse upon reinfection, which to me says that my body is slowly deteriorating at every single infection, which makes just looking at the future a very dangerous and anxiety-filled thing. And not just for me, the same goes for the immunocompromised who are in a very, very precarious situation right now, because although governments have decided that the pandemic is over, like you said before, it is not, and it is not as benign for a large part of the population, of whom part of the immunocompromised that are not able to get vaccinated or who do not get the same level of immunity from the vaccination. For them, this is the most dangerous part of the pandemic. All restrictions are being lifted. A lot of people do not see COVID as a danger anymore, but for them, it's still as deadly as it's ever been. And so for them, there need to be protections. They have been shielding for the longest time because they knew at the start of the pandemic that even them getting a mild case of this virus could have severe consequences. And that is still the case to this day. Yet at the beginning of the pandemic, there was special attention to their needs. And this special attention seems to be lacking right now. And so immunocompromised children do not get protection from infection at school. Immunocompromised workers do not get this protection from getting infected at work. And this is all while at the same time that long COVID is not being seen as an occupational disease in most European countries, with all the effects and the support that goes along with that. So basically, for most of the people who got sick, who were sick at the start of this pandemic, they're in a situation that they cannot think their way out of. There needs to be financial support for these people. There needs to be measures in place so that they can actually get safely through, the government lifting these measures. But really what it comes down to is that although it is more dangerous for them, although it is more dangerous for a long COVID patient, the danger for all is still there. And so you mentioned, Mr. Horton, you mentioned the tranquility. There's a message of tranquility going around, and that is being communicated by the WHO. It is very clear that this tranquility is currently not present all throughout Europe. There's a labor shortage based on the sheer amount of long COVID patients throughout Europe that is being worsened day in, day out, as long as we don't bring infections down. And this has been something that long COVID patients have been warning for 2 years now. We now see it happening. We see it real time. And this is a situation that's getting further and further out of control. We cannot ignore it because, you can try to ignore it, but it's rearing its ugly head already. So it's time to face it and actually deal with the consequences of letting this virus run rampant and actually take care of the people who have gotten the worst effects of it. I have to say, and kind of apologize, I'm kind of rambling at the moment. Part of that is due to reinfection. I've tried to make myself as coherent as possible. But yeah, I gotta say that's the truth of long COVID for everyone listening now. So thank you for hearing me out, and I hope it made sense.
It did make sense. Thank you so much, Vicky. Thank you, and wishing you a very speedy recovery. Our next speaker is Lawrence Davies from the Belly Mujinga campaign. To remind people, Belly was a rail worker who died in April 2020, having been spat on by someone with COVID. The campaign is fighting for justice for her and her family. Her terrible death is also a poignant reminder that behind the statistics are tragic stories of real people. Welcome, Lawrence.
Hi.
Hiya.
Hi. Thanks very much for that. I'm going to speak a little bit about how COVID's affected the workplace. I suppose I ought to start by saying zero COVID is obviously very important, and we should redouble our efforts to achieve that. I also put on record that I'm triple vaccinated, haven't yet contracted it, although my family have had it, but fortunately only a mild variant of it. So COVID in the workplace, what does that look like from an employment law point of view? Well, obviously, health and safety risks at work have increased. Where there hasn't been adequate PPE, that's doubly so. And we know that the health and safety risks fall disproportionately on frontline workers. And we also know that of Black workers, they're disproportionately employed within frontline roles or within the low wage economy. And we know that the low wage economy is normally anathema to adequate PPE. So a lot of the problems and mortalities and serious illnesses have occurred in those contexts. Also, although people who occupy more professional roles or more roles that are more suited to remote working could say that their health and safety is better protected, and in a way it is. Most of us are finding we're working longer hours and we're subject to heightened anxiety because of a lack of human contact and social contact. And so that of itself is causing impacts on immune systems and difficulties. In addition, of course, we're going through an economic downturn. Redundancies are not so well announced or visible, but they're occurring, and a lot of people are moving into quite insecure gig type employment, which is not really substantive employment. And where we're involved, we're seeing quite a lot of people who are either complaining about health and safety as whistleblowers being victimized, or we're seeing bias in recruitment selections, which fall disproportionately against BAME workers, female workers, and workers with protected characteristics who are kind of removed using COVID as a cover for that removal. And obviously there's a downward pressure on wages, and so job security's affected, and the ability to assert your rights is probably reduced during COVID because people are actually scared. And a number of people have approached us to say, look, this is a health and safety position at work. I'm genuinely scared about the impact of going to work at the moment, but they're not prepared to whistleblow, and they're not prepared to take a stand because they can't afford to be outside of the workplace and lose their employment or be retaliated against. And statistically, you are very likely to be retaliated against if you carry out a protected disclosure or whistleblow or a protected act. It's almost about 95% likely you'll be retaliated against if you speak up. And that's why statistically, 30% of workers, BAME workers, will experience racial discrimination at work, but only 1% will formally complain about it, which means currently 99% of incidents of racism at work go unreported. And that's particularly unfortunate given that racial harassment at work has doubled since 2017. So TUC reported in 2017, racial harassment at work was at 16%, but by 2020, so when COVID pandemic began, it had almost doubled to 31%. And yet of that 31%, only 1% were actually formally complaining about it. In terms of racism in the workplace and Belly Majinga's case, Belly Majinga, Black African, was a frontline worker working for Govia Thameslink at Victoria train station. She had an underlying health condition. In February 2020, she complained about racism by her supervisor. That same supervisor on the 21st of March decided to send her outside on the concourse without any PPE or without any adequate PPE, even though she wasn't rotated to work outside that day. That day, she and another Black African co-worker, Motalani Samola, were assaulted by a large white male for reasons unknown, and he did so twice. He basically berated them, walked away and berated them again. And during his beration of them, he, they say, said he had COVID, and he deliberately coughed or spat on them. Most of the spittle hit Belly. Belly contracted COVID and tragically died on the 5th of April 2020. As yet, the identity of a white male who assaulted them is still unknown. He's still hiding from public gaze. And we are seeking an inquest into the death of Belly Majinga, and we're pleased to announce that we've made some progress on that, in that there's likely to be an inquest beginning on the 27th of June this year, listed for 7 days, if we can get past the expert evidence first hurdle, which is that the expert appointed by the coroner has to say it's more likely than not that Belly contracted COVID in a workplace rather than outside of a workplace. And we're awaiting that report when it's commissioned by the coroner, but we hope to proceed in June. And I think if we do proceed in June, it'll be the first time we can look at some of the underlying health and safety and racism issues which affect frontline workers during the COVID pandemic. I think that obviously that's going to be very interesting because 2 million people supported Belly and the fight for justice, but obviously racial equality and the fight for justice is not achieving justice after a Black worker has died, but racial equality has to happen from birth. And we're a long way away from that. But the context within which all of this is happening, of course, in the workplace, is Liz Truss's speech of 17th December 2020, which I really recommend everyone reads because it sets out where the Conservative government are putting their fight for fairness during COVID and thereafter. And what they say, if you haven't read it, is that the fight for fairness in the workplace and in our society will be achieved if we tackle the scourge of geographical inequality. Fairness, they say, is not achieved by tackling or prioritizing fight against racial discrimination or the fight against sexual harassment or sexism. These are incidental to the scourge of geographical inequality. Specifically, they say that labeling something as institutionally racist is unhelpful, that unconscious bias training is a waste of time and actually creates more division. And Liz Truss announced that day, of course, that government and civil service would no longer be trained on unconscious bias. So 80% of racist incidents caused by unconscious bias, those who perpetrate it will never have a training to think that there might be another way of approaching that problem. And so it seems that the fight for fairness is also about targeting of activists. Sorry, my 9-year-old child is trying to, thank you very much, thank you. He's heard my croaky voice and has assisted me with a glass of water, which is very thoughtful of him. And yeah, the attacking of activists and the appointment of people to the Equality and Human Rights Commission to carry out the government's agenda. The Equality and Human Rights Commission, of course, was supposed to be an independent body, but Liz Truss, she said that she was appointing 3 new commissioners and a new chairwoman in order to carry out their agenda to fight for fairness, which means no findings of institutional racism ever again by that commission. That's something which must be of a concern because it means that systemic and structural racism will be removed from public dialogue. But interestingly, Liz Truss also said that economically, if you've got full representation of BAME workers at work, it would make the government, the UK economy £24 billion a year. So that's what you can get if you introduce race equality, and that's the government's own perspective, an extra £24 billion a year. So then you think, well, why don't they do that? Because that's good for business, surely. And the answer is because the flip side of the move towards racial equality is that BAME workers, because of the ethnicity pay gap, BAME workers are currently owed £300 billion in back pay in terms of equal pay, and nobody wants to grasp that particular nettle. So if we got the 300 billion and put that into Black communities and Black workers, then we'd take a big step towards racial equality. But this government isn't about redistribution of wealth or even paying contractual debts owed in terms of equal pay. It's about, focusing profit for the rich, and a lot of people, of course, are profiting out of COVID. So I think COVID gives us a chance to reflect on where we are in terms of the workplace and what sort of workplace we want for the future. What concerns me is it's becoming an increasingly vicious place and a place where health and safety is increasingly under threat, rather than a more enlightened place where we practice more tolerance to one another. And if we don't reverse that trend, I think the legacy of COVID will be something quite sinister. Thank you.
Thank you so much, Lawrence. Thank you very, very much. Our next speaker is Diane Abbott MP, one of the co-conveners of our campaign. Diane is going to situate the current phase of the pandemic in the overall political crisis in this country. In particular, she will focus on the popular opposition to the government's handling of the crisis. She will also show how it is being used to pursue a damaging agenda of austerity and reactionary policies around nationality, immigration, and civil liberties. Welcome, Diane. Sorry, Diane, you're muted.
Thank you very much, Nemo. Can you hear me now?
Yes, yep, we can hear you.
Very good. I mean, first of all, I wanted to thank everybody for coming, and I wanted to thank all our speakers who were all very interesting and very relevant. I was very pleased to hear from the speaker just before me about the vulnerability of Black and ethnic minority workers on the front line. And it was interesting what he said about the financial contribution Black and minority workers could potentially make to the economy. He said that the reason the government wouldn't act on that is because they don't want to pay back pay. I would say the other reason why the government won't act on it is because it's very much a theme of this administration's appeal to certain white workers in the workforce that they are promoting policies that are fundamentally racist and discriminatory. So it wouldn't suit their project to be actually facing up to racial inequality and doing something about it. I was very pleased to hear from Richard Horton. It's always a pleasure to work with Richard. And he said perhaps the single most important thing this evening, that we are still in the teeth of a public health crisis. And I'll come on later to why this government, and particularly Boris Johnson, are trying not to face up to that fact. My colleague, Belwabira Addy, spoke about the international context and how, because they have better public health regimes and are more still conscious of the dangers of coronavirus, it's actually the richer countries that have been worse affected. One of the other important issues that Richard raised was that not just this government, but the World Health Organization is selling us a lie about the idea that the worst is over in relation to coronavirus. There was also another important point made about vaccine inequity. It's quite shocking to be reminded that although there had been 10 million doses of the vaccine worldwide, there are 28 countries, mostly in Southern Africa, where less than 10% of their populations have had their first dose of vaccine. In Nigeria, it's only 2.5%. So what is the political context for this? And why is the government trying to tell us that, we're past the worst when it comes to coronavirus? I believe that Boris Johnson and his ministers are anxious to tell us that we are past the worst because it suits his political agenda and it suits him in trying to project himself as a winner who has, quote unquote, delivered for the British people. And that is why he and his ministers have sought to pretend that we're over the worst, have not continued with important safeguarding measures like universal mask wearing. And it is as if, in order to prop up Boris Johnson politically, they are prepared to see more deaths. And as we know, it's poorer people and Black and minority ethnic people who are more at risk from COVID. So we have to understand the political context. We have to understand how it politically suits the British government to try and downplay coronavirus and claim that we're past the worst, and also refuse to learn from what other countries are doing to fight coronavirus. Because, if we don't fight coronavirus, and if we don't go for zero COVID, then the virus will have won, with the terrible consequences for the poor and Black and minority ethnic people in this country and people worldwide. Finally, what I would say is this. As Richard said, actually, towards the beginning of this meeting, this is all about trust. And I have never known a government which has so little trust than Boris Johnson's government. This is what the polling tells us. And trust specifically on coronavirus. So the single most important thing we can do, apart from making sure we're vaccinated, encourage other people to get fully vaccinated. I myself have, had all my vaccinations, including my booster. Wearing our masks, keeping far apart from people and so on. The single most important thing we can do in fighting coronavirus in Britain at this time is getting rid of this government and getting a government that we can trust. Thank you very much for letting me speak.
Thank you very much, Diane, and thank you to all of our speakers. We had one final speaker, but they're actually not on at the very moment, so we're just going to give it a few minutes. Should be having Ramona McCartney from the People's Assembly Against Austerity. But before Ramona joins us, I just want to say thank you to all the fantastic speakers this evening. Thank you to everyone who's been streaming. Just a reminder that these meetings are recorded. They're available to be watched again and again and again as many times as you want, and shared on YouTube. I think we're live streaming on Twitter, but the video is definitely available on YouTube and Facebook. So please do share that with friends and colleagues and family. And just going to give it a minute to wait for Ramona. Okay, just a quick update. Ramona should be joining us within the next minute. So hopefully 1 more minute, we'll have Ramona with us. Hi, Ramona. Sorry, you're muted. Okay, let me just do a proper introduction. Thank you for joining us. Again, our final speaker is Ramona McCartney from the People's Assembly Against Austerity. She will speak quite briefly on the importance of their demonstration this Saturday, or really the series of demos that are happening across the country. We have heard from other speakers how the issues of COVID and of austerity are linked. So this is an important demo. Thanks, Ramona.
Thank you so much, Nemo. And sorry to slide in here sideways at the end of the day, but I think you know, I'm sure you can imagine what it's quite like at the moment. We've got over 30 demonstrations UK-wide at the moment, and yet we've still to upload and update our website. So I advise people to have a look at that. And I guess the reason we're here, and I'm sure you've spoken about this a lot this evening, is you know, the austerity that has never gone away. We've suffered 12 cruel years of austerity, and thank you so much to Diane, especially Diane Abbott, who has always been there at the forefront fighting the anti-austerity cause, and one of the sort of leading forces within the Labour Party to, you know, change the Labour Party from I mean, to be honest, an austerity party to an anti-austerity party, and helping with that movement that sort of brought us to a place where we were able to put Jeremy Corbyn in as a leader and change the whole party into an anti-austerity party. But, you know, there's, as we know, politics is a funny game, and will always have stumbling blocks along the route. And I think that we have more than a stumbling block right now, and we've got a government that is absolutely out of control and reckless, and is hell-bent on increasing austerity to the level that we've never seen before. And unfortunately, in my opinion, we don't really have an opposition that's speaking for ordinary people. So that is why I think that when the People's Assembly launched our talk to our local groups about having this coordinated action on the 12th of February against these price hikes and everything else that's happening around that, the cost of living crisis, it has taken off like nothing we've seen before, not for a very long time. And so I think I'm here really tonight to, you know, implore and speak to anybody that's listening that you get involved as much as you possibly can in your local area. If you visit the People's Assembly landing page, it's very easy to see and find your local protest. If there's not one there in your area, please contact us, and we'll help you and guide you through to setting one up. And by no means is this, we're going out on the 12th of February to protest and go home and think we did a great job. Absolutely not. This is definitely the first step that the People's Assembly has taken, and we've got big plans moving forward right through March, right through April, and we will be working then alongside trade unions and the TUC to hopefully bring that to a bigger conclusion. And also to protest the Tory Spring Conference in Blackpool. So I would say keep watching the People's Assembly space. This is bigger than all of us. It's bigger than any campaign group. It's bigger than anything. This is actual lives at risk. This is millions and millions of households in absolute danger of going right under. And I think collectively we have to make sure that we stand strong, stand together, do what we can on the 12th, but when we finish the 12th, look out for the next wave, and then we redouble it and we redouble it, and we make sure that we are a strong opposition and something to be reckoned with. Thank you so much for having me on tonight, and thank you for everything that you're doing.
Thank you very much, Ramona, and thank you for everything the People's Assembly is doing. And just a reminder, the demonstrations across the country this Saturday. Thank you to everyone for joining us again. Please do follow the Zero COVID Coalition on Twitter, Facebook, YouTube. Thank you very much, and have a wonderful rest of your evening.